You are now recording.
Thank
Please
you
stay
very much,
muted.
and thank you, Aurelia. Uh, First, let me say I'm really impressed to see the numbers. When Larry said that you'll have some students, I thought maybe it's a couple of students, but clearly there's a lot of enthusiasm and also a lot of need. So second, let me say that I only came into this very late on Thursday. So I haven't prepared slides. I'll try and talk through things. I don't know, since the meeting is being recorded, people can always go back to the recording and try and make sense of anything that I may not have clarified, or maybe you were unable to pick during the notes. The third thing I want to say is that you come from different universities, and each university normally has different templates of how they want proposals written, and whether they want a justification, whether they want an introduction, whether they want a problem statement, objectives, etc. So I'm not going to try and stick to a particular template. What I'm going to do is try and walk you through how you define your problem and how you define your scientific gap, and then how you define your objectives and the research questions. So the research questions and your objectives. In fact, one of the challenges I've seen, and yesterday I happened to have been in an event where I was judging together with some other people, posters for nurses and hospital workers in a hospital where they're trying to encourage the staff to join research. And they were pretty good posters. But every time I asked, or every time I went to a poster and the person started explaining, the first thing they start explaining is what they are doing. Oh, we are looking, I'm going to be looking at why nurses don't come to work, or I'm looking at the effect of 1, 2, 3, or I'm using Bayesian modeling to do 1, 2, 3, and ask them why are you doing that? And that's where people struggle, and that is where you start defining your problem. And I'm going to try and give examples from both social science side and also from lab sort of biosciences side. And I'll largely use malaria as an example, but I'm happy to also use other disease conditions. So let's take that you want to do a study or your proposal, your project, and you've been asked to define the problem. So the way you need to think about it, and again, I'm assuming most people are from sort of health research, but you could be from climate, you could be from, I don't know, maybe urban planning. Some of you could be from doing PhDs in environmental science, or even political science, or whichever. But I'll use health research because that's where my strength is, and that's where I understand best. But I hope that the examples I'll give, even if they are largely focusing on health, will apply to whatever area of PhD that you're doing. So let's take the case of health. At the end of the day, all research that you do, you want to solve a social problem. In case of health, you ultimately want to do 2 or 3 things. You want to reduce deaths, what we call mortality. You want to reduce morbidity, that is being sick. And you want to improve well-being. As has been said, health is not just absence of disease, it's also having a positive well-being overall, psychologically and physically. So that has to always to be, that is your goal. And so when you're doing health research, you want to tackle the cause of mobility, the cause of mortality, in other words, the cause of being sick, the morbidity for those of you who are not from health research is death. You want to reduce death, you want to reduce disease, and you want to improve well-being. So you have to demonstrate that whatever research you're doing will end up doing that. So let's take malaria, or let's take whichever disease condition. So your first task is to demonstrate that that is a problem. And you can demonstrate that that's a problem because of either existing data. In many countries, you have a sort of periodic reporting from hospital, and that data is normally collated by ministries of health. So you can use that data to say, in this country, in Kenya, in Ghana, in Ethiopia, the data coming through from hospitals show that there's a very large number, a large proportion of patients coming in with malaria, with cholera, with whatever other issues they're coming in. So it is a problem. We are having 200,000 deaths from trypanosomiasis. We are having 200,000 deaths from leishmania. And so it is a problem. It means that it has not been solved because we are still having 200,000 deaths. We are still having 1 million people attending hospital every year. So that is your first point. There are other places you can get the data from. Sometimes we don't have very good data, but we have what you call anecdotal evidence. There's been an increasing reporting of this sort of disease. For example, for COVID, the way they picked up COVID is that they noticed an increase of people going into hospital with atypical pneumonia, with pneumonia that is not typical. So doctors start realizing, hang on, we are seeing a lot of people with very severe pneumonia. And very quickly they started recording those cases. And those cases then hit the media, they hit the Ministry of Health, and that becomes a problem. So you need to justify why you're looking at a particular problem. And I said I'm using health, but I acknowledge that many of you will be from other areas. It could be climate out of rivers, or River X that used to run throughout the year now no longer runs throughout the year. It has dried. And the impact of that is that there has been massive loss of, agricultural loss. And the impact is that there's been increased food insecurity. And food insecurity is manifested in increased stunting of children, or is manifested in increasing number of children who are now being admitted in hospital with severe malnutrition. So, or, we have seen increasing cases of X condition being reported in the newspapers. So this is your first point. Or, yes, we are now starting to see an increase in the numbers. So in one case is where I began with a case where there has not been a reduction over years of this particular condition, with malaria continues to be a big challenge, or a case where we're seeing an increase. In the case of COVID, there was an increase of atypical pneumonia. So you need to be able to point out that as your first reason. So you want to solve that. And then the second point you come to then, having demonstrated that this is an important area to tackle. And why is it important is that you can have conditions or situations which, yes, they have a big, and so let me back up a bit on myself. So there's an issue of numbers. That's one. The second is the issue of impact. So you could have a disease, for example, malaria, for many of you don't know, actually has relatively low mortality rate. In other words, out of 100 people who get children who get malaria, maybe 5 will die. Now, of course, 5 kids dying is bad, but in terms of public health, that's low mortality rate. But it affects such a huge number of people that even though mortality rate is 5%, you still end up with 500,000 children dying. And you end up with another almost 200 million people getting sick. And that has a big impact on the health system. On the other hand, Ebola generally affects a very few people, but it has very, very high mortality and a very high spread rate if you come into contact with an Ebola patient. So importance is a combination of the numbers and the impact. We also have chronic conditions. Sometimes they may not affect a huge number of people, but they have a huge impact on costs because this person doesn't recover. So you're talking of 20 years or 30 years of input into this person's life, whether it is treatment, whether it's every week they have to go for dialysis in a hospital, whether it's that they require a full-time carer. So this has a huge impact because of the long-term engagement with this person. So these are things that you need to define in your problem. You're saying condition X is important because of the total amount of resources it sucks from the community, or because of what we call, for those of you who are in health research may know, disability adjusted life years. This means that if a person lives with disability for 20 years, although they live to be 40, in reality, they have lost 50% of their life years to disability. So you can coach your problem in terms of disability life years, or what also we call quality of life adjusted, quality of life adjusted life years, which again is to do with things like what is quality of life you're living. Imagine you're living with chronic pain. That really undermines the quality of life you're living. Imagine you're living with a stigmatizing condition. You have a big tumor on your face. It may not be painful, but it creates stigma. So you need to define what the final problem, and the final problem is either death, it's disease, it's quality of life lost, it's disability adjusted life years, it's quality of living because of things like stigma. So those are the things you are addressing. And they also then, many of these have an economic impact because they reduce productivity. So you could also, again, define your problem in terms of productivity or economic loss. Those of you who are in vet, you will say, this particular pests or this particular parasite reduces milk production in cows, and that has a direct impact on the economic status of the farmer. This particular pest or reduces agricultural productivity, and that again has an impact on the economic status of the farmer. So we are looking at first defining what is it that I want to do. So therefore, at the end of the day, whether directly or indirectly or immediate or through steps, what you're saying is, I want to reverse that. I want to improve people's well-being. I want to improve people's socioeconomic status. I want to improve climate so that it improves the way people live. I want to reduce death. I want to reduce mortality. So then the next step is then asking, why do you think this is happening? So again, let's go back to malaria. We've seen it has not reduced. So what is the issue? And this is where it depends on which discipline you're coming from. If, let's say, you're coming from the biosciences side, you will say, part of the reason is that we don't have effective control measures. And those control measures could be biological. In other words, our ability to prevent people from suffering the disease in terms of the biological pathway, i.e., maybe you don't have good treatment, we don't have a good vaccine, and we are maybe unable to prevent mosquitoes that transmit malaria from landing on people. But then you could argue maybe, so that means that as a bioscientist, you're saying, I want to look at the question of vaccines. We know vaccines are extremely effective in preventing diseases. We don't have one in malaria. Why is that? We still don't understand the full biology of the malaria parasite properly. And therefore, this is what I want to address. Malaria kills 200,000 people every year, or 400,000 thereabout, affects 200 million people. We have potential interventions. They don't seem to be working. My interest in particular is the question of a vaccine, and we don't have an effective, many of them, we do have one, but it's relatively low efficacy. The only reason we rolled it out is that the number of people who suffer malaria is so huge that even if it's only about 40 to 50% effective, we still have rolled it out. So you're saying we still don't have an effective vaccine. It's because we don't understand the biology properly, although we have a certain hypothesis, or there is work up to this point. And what my work is going to do is build on this aspect of bioscience research around the biology of malaria parasite, so that I can inform the development of a more effective vaccine. Well, there's another reason why people could be dying of malaria. It could be that we have vaccine, we have good drugs, but people are not, they're not being availed to people. Why? Because the health system is not working. Or you hypothesize that the problem is the supply system for the hospital. So I'm talking now to people who are in in health systems research. So your hypothesis is that it's not reaching the hospital, and the problem is the supply line. So I am interested in understanding the handicaps or the challenges along the supply chain of medical commodity supply chain to hospitals. I want to understand where the bottlenecks are. I want to understand, is it a systems issue? Is it an infrastructure issue? For example, vaccines or drugs may need cold storage. Is it a personality issue? We just don't have enough people to handle that. So now, or is it a governance issue? Is it a financing issue? So you've moved from malaria killing people and causing disease to hypothesizing that the issue is that hospitals, or not necessarily hypothesizing, actually using data that shows that they're not getting drugs and vaccine into the hospital, but it's not clear why. So your research gap, that is where now you're coming in. You're saying it's not clear why. It's not clear whether it's just the transport system. It's not clear whether it is the resourcing for getting the drugs to the hospital. You're not sure whether it's a workforce issue. So you're coming in from that point. So with the biosciences, we said it could be a poor understanding of the biology of the malaria parasite, or the mosquito, and we are trying to look at biological interventions. For the health system person, you're saying it's a systems issue, because we are lucky we have the drugs for this disease, we have the vaccines, but somehow they don't seem to be reaching the hospitals where they can then be prescribed. And If you're coming from a economic side, you may be saying, is it a resourcing issue? If you're coming from governance side, if your page is around governance, you say, is it a governance issue? If you're coming from if you're a logistics person, that's your PhD, then you're looking at, is it a logistics issue? Good. So we have moved from biological to systems. It could also be that we have the biological interventions available. The system is working and getting the commodities or the interventions to hospitals, but people are not arriving on time. The kids are being brought very late. And you want to understand why there's a slow uptake of these interventions. So now coming from a social science side, you're saying, I think the problem is the uptake, the challenges with uptake. And you want to understand what is that, what are the challenges in uptake? Is it a cultural issue? You know, there are some diseases where people say these are not biomedical, these are diseases that have other causes, they have spiritual causes or whatever you may call it. And it means that people first will take their child to a healer, to a herbalist, whoever, before they come to hospital. It could be issues of power dynamics and gender. So you're a person who is studying gender issues, and you're saying the problem is that the mother can tell that the child is sick, but they can't go off to hospital until the husband allows it. And you want to look at ways you can develop interventions for that community that will empower women more, will encourage the husband to be more supportive or to make faster decisions around health-seeking behavior. It could also be a question of education. We know that maternal education has a big impact on infant and child survival. And you could be, again, looking at that area. Is it understanding? Is it knowledge, practice, and attitude? So you are identifying, depending on your discipline, what do you think is the cause? But remember, our main problem is that malaria is killing 450,000 people and infecting over 200 million. And it is causing so much loss in productivity. It's causing so much loss in quality of life lived. It has a huge disability adjusted life years impact. You could be coming from epidemiology side, where you're saying, actually, we've seen an increase in malaria in this area. We don't understand why. I want to look at the temperatures over the years. I want to do time series analysis. I want to do, use GIS data to look at vegetation cover. Has that changed? Is it because of agricultural practices that have been going on? If you're coming from entomology side, the people who study insects, you may be saying, are we seeing new species of malaria transmitting mosquitoes penetrating this area? So, and if they are, you may be interested in, is there a new species coming in? Number two, why is that happening? Because we know different mosquitoes have different environmental requirements to thrive. Is this happening because there has been a change in agricultural practice? Now we are starting to use a lot of irrigation. So there's fresh water available, and that attracts a different type of mosquito from the ones that tended to thrive there when it was dry and there was no irrigation. Have we cut down vegetation cover? Or are even people starting to do activities that expose them to mosquito bites, where before they weren't? For example, people have started going to the forest to do certain activities. Within the forest, we find that there's a lot of different types of mosquitoes that are not available or are not seen in the urban settings. So you're coming from, this is a problem you want to solve. This is the data that's available. This is where I think we have not addressed. This is my question. Now, there is also another way you can approach that. So one is where we don't know. Two is where you're saying, we have always known this question, but we couldn't resolve it because we did not have the right equipment or technology at that point. For example, people working in genetics, let me use that as an example. Before, 15, 20 years ago, it took almost $1 million and months to do a full genome. For those not from biological side, full genome is your whole genetic code. For us to uncode it, it took huge machines and a lot of money and a lot of time. So it was very difficult to ask questions that require you to sample the genome of 100 people or 200 people, 300 people, just because of cost and the technology. Today, we have sequencing machines. Sequencing machines are the machines that will read your genetic code that are about this size. And that means, and it takes about 3 days to do a full human genome, and it's in the hundreds of dollars, not in the millions. So now we can come back and ask questions that require us to sequence the genome of 1,000 people. So your argument is, although this question has always been there, it was unsolvable because we didn't have the technology. Now we have this technology, and therefore I would like to use it. Or I'm going to apply this technology to address this question. Mobile phones, again, really good tools for collecting data in a way which before we could not collect data, or for sending reminders. For example, for in health practice, you send reminder for someone to take their drugs every so often. You're saying, I'm going to see whether we can use this mobile phone technology to do 1, 2, 3. Computing power. We have, my phone here now has more computing power than a laptop had about, I don't know, 6, 7 years ago. So there are things I can do now. And connectivity. So all these, this is your argument. Now here, what you're trying is to argue why you're taking a certain approach. Or this data is available in Europe, but is not available in Africa. However, when you use the argument for geographic absence, you also have to show why it is important. I.e., you cannot justify your PhD by saying this data is from Accra, but there's no data from Kumasi. This data is from Addis Ababa, there's no data from Bahar Dar. That is in itself is not sufficient of a justification, because just because there are two towns doesn't mean there's something. You have to demonstrate the difference. You have, for example, say Accra is in the equatorial region, whereas Navrongo is in the dry Sahel, Savannah region, or it's rural. Accra is urban. Therefore, we might expect, or Accra has a different genetic makeup. These are Akan people, whereas if you go up in Navrongo, you have sort of the Afroasiatic, the Fula and those sort of people. Similarly, you come to Addis, you say, okay, Addis is a big town. They have access to health facilities, whereas up in Garadawa, they don't have the same access. Education is much lower. They're Muslims, whereas in Addis Ababa, they are largely, Ethiopian Coptic. So you have to justify the difference. So it's not just enough to say, oh, this data is not available it's available in Lagos, but you don't have the same data for Abeokuta. You have to show why it's important to do it. For example, in a lot of our medical data, when we are looking at standards, a lot of standards are European standards for, let's say, your electrolytes, how much sodium, how much oil. So it becomes hard to apply that data to Africa. Some of the tests we use, for example, in psychology, they are based on European culture. So a child may be asked to identify a picture with a staircase. well, if you're growing up somewhere in sort of, I don't know, Maiduguri, you may not have seen, and I'm not picking on Nigerians as an example, you know, you may not have seen a staircase. So you're telling a child to identify a staircase. So you need to develop new cultural and context-specific tests. So these are arguments that you can use. This is your scientific gap. In biological sciences, it's often quite easy because you just say, we do not know what drives this. The mechanism is not understood. And therefore, this is what I'm going. I hypothesize, I think it is cytokine X, but that has not been demonstrated. The reason I think it is because there is a bit of data that have come through that shows that when people have a higher cytokine X in disease Y, this happens. And I hypothesize this might also be the case in disease X. Similarly, and so you need to, but it's very important, and this is something else I often see, that you make sure that when you say there's a gap, you have identified and you have investigated that gap. It's not just enough to say there is no data relating to this. And I often will have students put that statement, and immediately I'll just Google. Literally, we are sitting with a student, cholera and fresh water in Kano. There are 20 or 30 papers already. So just because you don't know doesn't mean it's not known. It's very important to be aware of that. Just because you're curious about something doesn't mean it's a scientific gap. I wonder why the Madinka tend to do things differently from the Malinke in Senegal. Just because you don't know doesn't mean there isn't. Make sure that you do as much search, both in the formal literature databases, but also in the informal ones. There are sometimes technical reports. Use Google Scholar, just Google directly. Then you will have a clear gap. Having then you start converting your hypothesis into questions. So you're saying, I think, based either on the complete absence, but with what you may call an educated guess, because you are synthesizing from other areas. You're saying there's data that suggests that shows that 4 years of education in women in Kenya has a big improvement on survival, or data that shows that just providing training for nurses increases their motivation. And when they're motivated, that has been seen to translate to higher survival of children in maternity. And that was done in Kenya. It's a middle-income country. We wonder whether that would be true in Cote d'Ivoire or in Tanzania or in Ghana. And I actually can say Nguyen, I think probably coming from Thailand. So I'm going to go all the way to Asia and Vietnam. So you're saying in Vietnam, education is not a big deal. There's a high level of education. So what other factor can be a motivator for nurses to follow, treatment guidelines? Because you're saying kids are dying. We think that the reason they're dying is that nurses are not following the guidelines for treatment for those diseases. Now, you're saying, depending on which discipline you're coming from, you may be saying it's because they're not properly trained, or it's because the management of the health facility is not well trained to enforce those guidelines, or that the nurses are just not motivated. Maybe they're not being well paid, or maybe there's understaffing, and therefore the nurses are tired and they take shortcuts because all the guidelines themselves are not context sensitive. In other words, you've taken guidelines from America where maybe the ratio of nurse to patients is 1 to 3, and in somewhere in northern Ethiopia and northern Kenya, the ratio is 1 nurse to 40 patients. So they can't follow the same system where you're required to fill in a sort of a clerking form or that has 40 questions. Maybe the guidelines need to be adapted so that you're getting the minimum and the essential necessary triage to start providing the care that that patient requires. So I hope I have helped you start structuring how you would argue, because what you want is to put an argument as to why your PhD is necessary. You then now restructure that argument in question. So this is the questions I'm going to be asking. I'm going to ask is what are the key factors driving nurses' motivation to follow treatment guidelines? And my question would be, do nurses know the guidelines? Are the guidelines available in hospitals? Do the nurses read them? Have they been trained on them? And then I'm going to explore why do they not? And I may use focus group discussion, I may use questionnaires, and I'm going to, and so I want to look at the attitude towards those guidelines among the nurses, the hospital managers, and the sort of other cadres of staff in the hospital. So I realize I've been talking for about 40 minutes, and I would like to stop now and take questions. As you notice, I did not go to specific templates because, as I said, your university will have a specific template. What I try to do is to help you define. And so you should always be able to, in 3 minutes, define what it is you're doing. You're saying, I want to solve the issue of malaria morbidity or mortality. I think the biggest challenge is that the health system is that the issue is at the health system level because drugs are not getting to hospitals. I think that the reason they're not getting there, and you're saying thing, but you're saying this based on the data so far, is a logistics issue. And there seem to, when I've looked, there seem to be no literature, no information around the logistics chain from the central stores to getting the drugs to Kumasi. And so that's what I'm going to look at, and I'll be investigating or interrogating the bottlenecks. I'll be looking at resourcing bottlenecks, i.e., are there lorries? Is it just lack of physical transport there? I'll be looking at health workforce bottlenecks. Is it training? Is it the numbers that are not available? I'll be looking at the governance bottlenecks, and I'll be looking at I don't know, something else. But I hope you can see in literally 2 minutes, I've defined someone's PhD. Over. And happy to take questions, Aurelia.
Thank you. Thank you very much, Prof, for that. Truly, truly. I think most of us have really gotten a lot because I think we start with what is the issue. We never quite start above it. What is the problem? So
Yeah.
that to me is quite, and it will really help me even in what I'm working on. So let's ask Prof some questions. You can unmute yourself. You can put on chat. Because this is the most important part of your research, because it anchors everything. Feel free to really ask, especially if you're
There's
stuck.
a question.
Okay, go
that
on.
says, so there's a question that says, can you use tuberculosis as an example, sir? Okay, so let me quickly define a typical tuberculosis PhD. So tuberculosis, I think still the third largest infectious disease killer. And so the question is, we need to resolve that. And the number of approaches you can take, depending on what side you're coming from. You're coming from biosciences. A big challenge is drug resistance. We see a lot of development of drug resistance. And for example, once you get what you call a multi-drug resistant tuberculosis, it becomes extremely difficult to treat. So there's a scientific gap there to develop much more effective drugs. But the other reason you see resistance rising in people is adherence. Why do people not adhere? Is it because the drugs, in some cases, people get quite bad reaction to drugs? So there again, there's a biological question there. Can we reduce the adverse effects of the drugs to make it easier for people using the drugs to use them. But also, people naturally become lazy in taking drugs. And so we need to find, and that's why you have things like DOT, directly observed therapy, for people who appear that they're not going to adhere. But you may be looking at behavioral aspects. What is it that causes people to adhere or not adhere? Can we identify? Are there ways we can, simple ways of identifying people who won't adhere? Are there ways that we can, are there programs we can use to train the caretakers or somebody who is their peer to support them, so that instead of overloading the health systems with directly observed treatment where you require the patient to come to hospital every day to get the treatment, is it possible to use somebody at home? Is it possible to use mobile telephones to remind people to take their drugs? In terms of spread, what is causing the spread of TB? We know things like latent TB, most people do have latent TB. Is, again, there's a whole line there you want to understand. If you're coming, I realize I didn't talk from the statistician side. You may want to model the impact of public transport on TB transmission. You can look at, is it cases increasing, for example, during rainy season versus dry season? Because rainy season, people are more likely to enter into a bus. And I don't know about other countries, but often in Kenya, people seem allergic to fresh air. As long as there's a bit of rain, they'll close all the windows. So again, you can start looking at the impact of public transport on your transmission models. You are, whether using your SIR model or you're using other more complicated models. And incidentally, especially for stats people, there are questions that have been addressed previously using different models, and you could say you're coming in now to use these newer models. For example, a lot of the statistics used to be what were called frequentist models. And now we know the strength of Bayesian statistical Bayesian approaches to data analysis. We also have big data sets, and these big data sets are not amenable necessarily to the simple frequentist models. So you start looking, your argument for your PhD as a statistician is that you want to apply Bayesian modeling. For people in social sciences, for example, now there's quite a strong use of what are called structural equation modeling. What these are, for the people who are not in maths, is that, for example, if we are looking at why people don't go to hospital, often people have multiple reasons, not just one reason. It may be partly because of the education, partly because of their socioeconomic ability. It may be that the hospital itself, people get bad treatment, so they have a negative attitude and all that. And you can inquire on all those, but sometimes it's not clear which one has the biggest weight. So when you use structural equation modeling, is really you putting numbers, putting weights to each of these paths and saying, actually, the biggest weight is treatment in hospital, how they're treated by the nurses. And so if we want to increase people going to hospital, we need to focus on this path. This is the one that has an issue. And you can only do that when you use maths to actually put the weight on it. So if you're from statistics side, there are also capacities, as I indicated. We have much more computing capacity now. So you can take big data set, integrate them, use machine learning to mine out patterns and new understandings that would not have been possible without the high performance computing capacities that now we have. And in fact, now we have seen people coming up with new hypotheses because they have been able to use machine learning to draw out things that they could not have predicted. You know, when you do unsupervised machine learning, you're able to pull out new patterns or new understandings that you couldn't predict upfront. So these are areas that you can use to argue. But remember, you're always trying to solve a particular problem, and those particular problems are related to human well-being, human survival and well-being. Even if you're coming from a climate side and you're modeling climate data and you're trying to predict where things might head, at the end of the day, what you're saying is this is going to impact on either availability, food security, water security, health in terms of exposure to extreme heat, increased risks of injury and death from extreme weather events, for example, hurricanes or flooding, loss of livelihood. So you start there. That's what you're trying to solve. Don't and ask you, don't tell me, oh, I'm trying to model rain in northern Kenya or in southern Kenya over the last 20 years. Or why are you doing it? And that's where people tend to start. And I'm going to use a Bayesian model. I'm going to use, a certain approach. But why are you doing it? Great. Let's continue with the questions. I hope the TB person is happy.
Yes, I'm sure.
Questions, please.
Ask questions. Please type them on chat.
It worries me. If you don't get questions, either people understood nothing or they understood everything. It's unlikely they understood everything. So I can't be that good. So it has to be that.
It's
It
the
has to be
latter.
questions.
Maybe you were very clear.
Yeah.
But I have one question as people are thinking.
Or maybe they understood.
Oh, there is one, eh? Okay. What are the parts of the problem?
Yeah. So what are the parts of the problem statement? Essentially, you're defining the burden of the problem. So what I'm saying is that you're defining the impact that the issue you are dealing with, the impact it has on human well-being. Then you explain a bit what you think are the potential causes, and then you finally explain why you are focusing on a particular cause or pathway. So a lot of it is what is the size of that problem? So, and then what is the cause or pathway? What part are you focusing on? And then just find why you think there isn't sufficient information or evidence to solve that problem. And that is why you come in. Next person.
Question, eh?
Yes.
Same. I was wondering, we are writing a problem, eh? Okay, I was told that you need what you call what is the ideal, what is the ideal, what is on the ground today, and what are you proposing to do to solve the problem? Now, what I was wondering is when you're identifying a problem, should you justify using any citations according to you? I know many people have a different way of thinking, but should there be citation or citation should appear before in the maybe background of the study? Thank you.
To me, and that's why I say different universities and people, the challenge I find with a lot of universities, they're very tied to a template. According to me, you should cite if it's available. For example, if you're going to work on TB, I've seen somebody say, can you look at TB and post quality of TB? It's the first point, any position, you'll have to be able to tell me why you want to work on TB. And as I said, we are solving a social problem. So you're saying TB continues to be the third largest killer in terms of infectious diseases. And it has a massive drain on the both in terms of loss of livelihood, but also in terms of resources required to control it. And it's also well known that even after recovering from TB, we have, depending on the severity of TB, you have ongoing challenges. People are still more vulnerable to respiratory diseases. Some people come through with things like bronchiectasis, and that has an impact on the quality of life. What we don't know is how easy it is to predict which person will come through and end up with bronchiectasis or other post-TB sequelae that impact on their life. So from my point of view, you should be able to justify why that problem is big enough or is warrants being investigated. And so what you're saying, and I agree the person is saying, you can say, this is what we know, this is what's happening, but this is where you don't know. Because again, your problem statement has to show that there's a problem. There's a problem in terms of the issue that you're dealing with, but there's also a problem in that somehow it has not been resolved despite the presence of 1, 2, 3. So despite having good TB treatment, we still see a lot of post-TB sequelae. And I think that the reason for that may be things like how advanced the TB was by the time the person came to hospital. Can that be a good predictor? You can model that. So that's the way I would coach it. What I was trying to do, as I said, I was avoiding going into the template because you can argue as to whether you should have this or this. I was helping you first. How do you define your problem? Where you will throw each of those depends on the template of your university. Next question, please. And Pijani, are you happy with that?
Pijani? Yeah, thank you. I'm very happy with that. So I'm also, when you are talking, you made mention of Lagos, Abeokuta. I said, So I'm in Abeokuta in Ogun State, Nigeria here. That's where I want to do my studies. And I think maybe you have possibly visited Abeokuta before.
Well, I visited Ibadan and other places in Nigeria. And of course, you can't give examples from Africa without talking about the largest population in Africa. I'm sure, Tinjani, that makes your heart a bit happier.
Yes.
And I see a boy and others. Okay, so if there is a question from Millicent Otina, let me just read it. If your area of study doesn't have data, newspaper reports that is a problem, like disabled athletes are not engaged in sports as they should, coming from lack of available sportswear that addresses their need. How do I go about this issue of background study or evidence of problem? Okay, let me try and tackle this. So first, I see you've made a statement. You said it's lack of available sportswear, but you really don't know that. You could, for example, say, although you're saying that there's no data, there's actually some level of data. You could argue that in your country, this is units from Otina. I don't know whether it's in Kenya. You can demonstrate that there's hardly any sort of people with a disability, disabled. Let me use the word disabled in a polite way, but yeah, there's no disabled netball or basketball teams or even league. Whereas in the US, there are basketball leagues of people with disabilities. Or we don't see them participating in marathons. Yet when you look at major marathons, whether it's Paris or London or wherever, or Bahrain, you normally see there's a whole category of people with disability. Or you could argue that if you look at the Olympics, a lot of countries or your country is not represented. That's your starting point, i.e., there is a point you're putting, there is some evidence. It may not be necessarily in your typical literature form, but there's evidence. That's your argument. You're saying the Paralympics done every 4 years. My country hardly ever. In fact, they only send 1 or 2 sports people, which suggests that a lot of disabled people are not engaging in sports. Now, there could be a number of reasons. There could be that the sportswear is not structured well, or it could be that the facilities required for disabled people are not available in the country, and that's what I'm going to look at. It could be self efficacy on the disabled people. It may be that they don't feel confident, and that they should also be engaged in sports. So you are, depending on which side you're coming from. Are you coming from social science study, where you're looking at the people themselves? What's the attitude towards sports? You know, do they feel that they should put any effort? Or you're looking at it from a resources point of view. You're saying the issue is they do want to participate in sport, but even when you go to a stadium, first of all, to enter the stadium, there's a staircase. Maybe they can't even go up that staircase and there's no allowance for wheelchair access. Or it could be we don't have coaches who are able to coach disabled people. Or, as you suggest, it could be that a lot of the sports gear, and whether it's in gym and other places, are not fabricated to cater for people with disability. So it depends on where you're coming from. But again, I hope I've given you an example of your starting point in terms of defining the problem, is that you're not seeing enough people in different sports, people with disability. Yeah. Millicent? Millicent, does that answer your question? Okay. Charles, come. Is it necessary to use statistical backed facts in arguing your problem statements? Yes. And there may not be full statistics, but as much as possible, you should demonstrate why it's. The point is if I came to you, Charles, and you're the funder or your supervisor, and I tell you, I really want to study, I think there's malnutrition in, Charles, I don't know where you're from, but let's say in Kenya, Central Province generally has a lot of food. I want to study malnutrition in Central Province. You know, I would ask you why. Or let's say I want to look at impact of planting blue gums in northern Ghana. I mean, unless you can show me that there is acres and acres of blue gums being planted, blue gum tree, eucalyptus being planted in northern, in Upper Volta region, then there isn't a problem until you can demonstrate. So there has to be a certain level of statistics. You can argue that it's not sufficient, but in other words, it could even just be an anecdotal report. There's increasing report of X happening. For example, there has been now 10 or 20 newspapers. We have seen several demonstrations. But if you're going to do that, the first thing you should do, even before you go to your problem statement, is go and investigate. Look for, because a problem can't just be based on your own perception. You can't say, you know what? I think I've seen 5 people with bicycles. I think there's an increasing number of bicycles now in this area. Therefore, I'm going to study the impact of riding on people's health in this area. It can't be based on the fact that you've seen 5 people. There has to be certain, and so if that was your area, what the next thing you do even before you come to your page, and this is allowed, is do a bit of pilot. Go and check, has there been an increase in sales of bicycles in the bicycle shops around your area? Then you can start there. But you have to be able to back your problem, arguing your problem, or justifying why you want to tackle that problem with at least some kind of trend data availability. Okay.
Yeah, thank you, Prof. Thank you.
Okay.
As well.
Okay, I can see there's Margaret. How do we go about with the issue of impact of immigration on national security? Keeping in mind security is a sensitive issue. And respondents from this area may not be willing to give information. So first, when you say you're looking at impact of immigration on national security, you want to demonstrate that there is a direct relationship between security, be it increasing or reducing. So your question should be, does immigration increase insecurity? And of course, then there you need to ask, how would you measure that? And I'm not an expert on this, but I guess one of the ways to measure is in how many instances has immigrants been involved in security issues? For example, because sometimes there's perceptions, and what happens is that those perceptions are driven by biases. And so you say, there's a lot of Ghanaians coming in now into our country, and those guys are driving insecurity. But as a researcher, as opposed to just a social commentator, you need to demonstrate that it is true that there have been an increasing number of cases that have involved immigrants compared to non-immigrants. And you would have, and so you would have to, and so can I also differentiate between perception and reality? For example, you could walk around an area where the immigrants and ask the locals what is their perception. Do they think that immigration or the migrants have increased? And a lot of people may say yes, but you may find that it's not backed by real data, because we all get a bit agitated towards foreigners. At first, foreigners are exciting, they're exotic. Once they reach a certain number, then people get agitated. So with this sort of issue that you're addressing, it's important to differentiate between perception and actual data. My first point would be to look at police reports and ask, do we actually see an increasing number of cases of crime that involve immigrants? Margaret?
Yeah, thank you so much. I have gotten the direction. Thank you.
Yeah. Now, I noticed, as I said, what I'm really focusing on is how you define your problem, not so much how you write the actual problem statement. You need to check, because as I said, some universities say you can cite, some people say you cite, others would be expect. But in general, good problem statement will be about 2 paragraphs. So we are talking about half a page, because it's really a summary of what is the issue you're trying to solve, what is available, why do you think that despite what is available, the problem is persisting, and therefore what you're going to do. And so for that, as I said, for template, go and check your own university's templates. For me, it's helping you look at the problem and how you start thinking about it. You can, in some universities, you don't do a problem statement, you do a justification. It's the same thing. How do you justify why you want to do what you want to do? Yeah. Okay, I can see Quinta Walker. I'm developing a proposal to research on factors influencing utilization of electronic, I presume you wanted to say electronic, not electric, medical records in resource-limited settings. A lot has been done, and I'm wondering if I'm on the right track, since I've identified several factors expounding on that. So there are 2 questions in one here. First, should I do a PhD on work that's already been done where there's a lot of information? The answer is no, don't do work, because your PhD you have to demonstrate that your PhD is adding new information. And that is why I say to you, when you start talking about the scientific gap in your problem, in making defining your research, you must be sure that there is an actual gap. Too many times I've seen PhD students really struggle because in defending their thesis, because they've been asked, so what is new? What have you? The first question has always to be, what new evidence am I contributing? So if there's already a lot of work going on, that's number 2. Also Google, find out whether there are other people doing this, and are they doing it? Are they likely to do it faster and better than you can? For example, in the biological sciences, people sometimes want to answer really sophisticated questions, which we cannot answer because we don't have the equipment, or it will take so long to answer, and yet someone in the UK, someone in the US can answer that question within a year because they're able to do high throughput work. And so what happens that by the time you're going to defend, so always also remember, you're not just looking at that problem now. You're also looking at in 4 or 5 years when you're defending what will have already been known that might nullify. One might undermine your PhD or even completely nullify it. So if you're jumping into an area, for example, that has fast-moving evolution of knowledge and information, then be sure you're also doing a PhD in a place that is capable of doing that very quickly. The challenge we have, and I'm not, blaming anybody, I'm just saying that's the challenge you have in Africa, is sometimes it takes us 5, 6 years to do a PhD, sometimes 7, 8. By the time you're finishing your PhD, that question is no longer even valid. Think about people who started doing their PhD around COVID, and then it took 7 years. 7 years down the line, the questions you're asking have either been solved or they're almost no longer valid. So it's important that you, coming back to the question, Quinta, don't, if there's already enough work done on this, don't try and just duplicate it. On the other hand, if you can identify that despite all this work, there is an area that doesn't seem clear. For example, when you talk about utilization, is it because it's unavailable? Is it because the devices required for electronic medical records are unavailable? Is it because, for example, many hospitals don't have power and would not be able to charge those equipment? Is it because the nurses or the people who would be inputting the data have a general they don't like using electronic records? Is it because it takes too long compared to just writing with a pen? So is it because the systems keep going down? But if the answers are available, don't repeat. Quinta, are you interested in following up on that with further question or anything? How do we identify the research gap, knowledge gap in the problem you've defined? The only way to identify, as I said, go through literature, both peer-reviewed, non-peer-reviewed, technical reports. You can't define a research gap unless you know what is available. And if you think of a problem, that's the first step. Even before you start writing or anything, you yourself just physically sit down in front of your computer, spend the next 2 days really looking. Has this been addressed? Don't start writing and then try and force it to become a gap. It has to be a genuine gap. So reading has to be your friend. If you're going to be a researcher, if you're going to do your PhD, you and reading and literature, same WhatsApp group in which you're the administrator. Aminatu, from Senegal, I presume? Or from Gambia? Go ahead, Aminatu. Go ahead, Aminatu. I think you're muted. We can't hear you. In the meanwhile, Lino, go ahead as Aminatu tries to connect.
Yeah, thank you, Prof. I was waiting for your last feedback comment on the literature.
Sorry?
Are you hearing me?
Yeah, I can hear you well.
Yes, I'm saying that thank you for mentioning on the aspect of literature. And I think that's one area that we always find challenges, in. There's many times you see, if my interest is, let's say, on urban housing issues, and someone wants to find out maybe what are the causes just an example, that what are the causes of urban, informality, and without exploring the literature, the person will want to force a problem onto what he wants to look at.
Yeah,
and
exactly.
And the challenge with that is that when you explore the literature, you might find that it's not actually the housing problem, it's something else. But you want to force something which is already known.
Yeah.
And many times we got caught up
Yeah.
in that mix, and then you begin to wonder maybe what's the problem. So the problem of wanting to start with a topic, which is okay to give you a picture of where you want to explore further, but keeping that like this is the fix, this is the final outcome that I want out, is always a problem. And all this goes back to the literature. If we do not explore the literature in the area we want to do, to be able to identify maybe what are the angles which are untouched, then it's going to limit us in terms of coming with a good problem statement.
I totally agree. Thank you for that contribution. And let's take out research. The beauty of research is that, so if you think about it, the more we know, the more opportunities there are for asking new questions. So the way I think about research is like a circle. So if you think of a circle as what we know, and everything outside the circle as what we don't know, you can see that when the circle is small, our boundary with what we don't know is also small. So in a sense, if we know little, we also know very little of what we don't know. I don't know whether that makes sense. So think about it. When we didn't have microscopes, we didn't know about germs. We knew very little about what causes disease. So we didn't know what we didn't know. The moment you knew about germs, suddenly it opened up a whole area of biology. If you have to use an arbitrary measure, suddenly there was another million questions to ask just about the biology of bacteria. Just by expanding that circle a bit, this was what we knew about disease causation. Now we suddenly know about microbes. That expanded the circle a bit. As soon as it expanded the circle, you can see now the boundary with what we don't know also increased. So suddenly we needed to know about the biology of the different bacteria, understand their nutrition, their metabolism, their transmission, the evolutionary biology, etc., etc. So it's the same thing. And the reason I'm saying that is coming back to the example that Lino gave, which was good. It doesn't mean that you still, let's say you're a person who is from, your PhD is around urban planning and all that. So you're looking at urban planning and you're saying it's really bad. There's a lot of bad planning. There are all these informal settlements cropping up in Legon, in Lagos, in wherever. You could say there is a problem. It's there. We can see informal, and the problem with informal settings. Remember again, what is the issue with informal settings? Is the areas where you can have increased disease, you have more violence, you have you have issues of health, you have issues of climate, their contamination. So they are not suitable for human habitation because the impact on what? Remember, we are coming back to well-being. So you want to understand why do we have them? Why are they cropping up in all these in Madanalim? Why are they cropping up somewhere in VI in Victoria Island, which, as we know, has normally been well? So then, because your interest is why they're cropping up, you start with all the potential causes. You're saying it could be governance. Do we know enough about governance? Okay, there you find out that actually there is a lot of, it could be policy. Do the policies themselves, are they clear where you can, where you cannot build? It could be enforcement. Why are they not being enforced? Why are the city planning, the urban planning rules not being enforced? It could be there's such high force of rural-urban migration that the system can't cope. But why is that happening? Why is there that rural-urban migration? It could be that the government has been wanting to remove those informal settlements and replace them with better housing, but there has been massive resistance. But why is there that resistance? Why is it that people somehow, ironically, don't want to move to be given better houses and move out of their bad ones? And this has happened in places like Kenya, in other places. You try to move people in South Africa, you move people from the townships and you move them to new, better places. And what do? They rent out those houses and head back to the informal settlements, because informal settlements also they are not just housing. Remember, it's an ecosystem. It's an ecosystem where you have your social support, you have ways of doing things. You're taking someone out of that setting into a different setting. I think I've defined potential areas which you can start addressing. You can look at all those as areas where is there enough? Do we understand enough so that we can then, because what you're looking for is modifiable factors. Factors that you can modify to increase or reduce the springing up of informal settlements. Is it a governance factor? Are they resource factors? Are they rural urban migration factors? Are they social factors? Are they political factors? Can we modify them? Yeah. Next question.
I think we have two, then we can have there is also Dr. Release here. We have this one for repeating the research gap. Then there was another one for Nico Uma for the curriculum. Quite ahead, he had asked, please give a case of educational research, curriculum studies. So I think, Prof, you can answer those two. Then we can have Dr. Release come in and please stay on.
Yeah. So for the curriculum studies, again, the first question is always, what are you trying to solve? So you have an interest in curriculum, but why? Okay, so let me use a case that interests me. And it's the question, let's assume we're taking university curriculum. It could be primary school, secondary school curriculum, but let's, for the purpose of this, take university curriculum or even secondary school and university. There's an issue of mismatch between what the market wants and what we are teaching. And so we find that there are a lot of reports in the newspapers of employers complaining about the quality or the poor fit of the people coming through from our universities into the job market. And in some cases, they're providing evidence by saying we're having to retrain them, or we have to first provide an extra set of trainings for them to fit. So you can already see the issue is, why are they not fitting? So a question you could ask is, what is the problem? Is the problem the curriculum? And there are a number of questions you can look at with regards to that curriculum. What are the contents, and how does those content compare to what the market wants? It could be that the content is fine, but are the teachers equipped to teach that curriculum? For example, in Kenya, we have just shifted from what was a more theoretical to a more practical curriculum. Gifty, please mute a bit. Yeah. So we moved to our curriculum. It's called Monene, what is it called? Curriculum-based CBC.
CBC.
It's a practical-based curriculum. Yeah. What is the C? The first C just jumped out of my mind.
Competence-based
curriculum. Yes, competence-based. The challenge you're having is, do the teachers have the capacity? This is the teacher who's been teaching the last 30 years. And now you come and telling them to start teaching a completely different curriculum, or curriculum that has a different approach to teaching. So that may be an area. And so the teachers themselves are unequipped. So you're looking at, are they equipped? But also they may just have a different attitude, because maybe they were not consulted in the development of those curricula. So again, that's an area you could be looking at teachers' attitude or the facilitators' attitude towards those curricula. What was the process of developing that curricula, and were they involved, and therefore are they enthusiastic about teaching it? Now there are systems of feedback that will allow this curriculum now to be slowly modified in an iterative manner to make it suit and fit for purpose. You could go to the other end and ask, are now the employers, are they happy with the people coming through now that this curriculum is changed, or we have this curriculum? How long, when is the last time that the curriculum was changed? And so there are all those questions that remember, you're solving the issue of employability and mismatch. And you are saying one of the reasons you think is that the curricula are not fit for purpose, or they are fit for purpose, but there's no capacity to teach them in the way they're supposed to be taught, or there is no feedback around the challenges of that curriculum. So the curriculum has become fossilized and it is not a live curriculum development process. So there are all those areas that you could explore. I don't know if I've answered the education curriculum one. And then the last one was repeating. As I said, research gap, there's no magic. If you have a question, you have to go into literature and actually show that it's not existing. Now, let me just take a bit of time here and re-explain. Remember, research gap could arise because no work has ever been done. That question has never been addressed before. It could be, for example, there's a new molecule that has been identified. We still don't know what it does. Therefore, you're asking, what does it do? That's a question. It could be, as I said, there's no data existing for that particular population. But as I said, you have to demonstrate that there's a justification for thinking of that particular population as different from the other population for which the data exists. It's not just enough to say, all the data we have is from Igbo. We don't have data from Fulani. You have to demonstrate why Igbo people, who are basically Southerners, are different from the Fulani, who are compared to the Igbo, who are what you call Benue Congo branch. So you have to be able to demonstrate that. Number three, the research gap could emerge because we have been unable previously, or all the studies that are available are actually very small and were not powered, sufficient power to resolve the question. So for example, there may be studies, but none of them meet the sample size requirements, and therefore the question is inconclusive. You could also be doing a research gap because there's what we call equipoise. Equipoise is where we are not sure, based on the current data, some data supports the conclusion you're seeking and some data don't. For example, when you do clinical trials, you may find that a clinical trial in one population shows that this drug is effective or is as good as the existing drug, and in another population, it doesn't appear to be effective or efficacious or has low efficacy. Another study is done again, and you find the same thing, and another. So now you have equipoise. In other words, it's not clear. The benefit of this drug or this treatment regime is not clear because the data seem to be contradictory, in which case you might want to repeat that with a bigger sample size across a different population to try and resolve that equipoise. The other research gap, as I said, I'm now concluding on the research gaps, is availability of new technology that may allow you to address that question differently. And you suspect that if you do it using this new technology, you might get new insights that were not possible with previous. For example, again, going back to the lab, before you needed to do whole genome sequencing across a whole set of cells. Now you can do what you call single cell RNA-seq. So you can look at a single cell and work out what's going in there. Or if you go to, again, I said in the social sciences, you can be able to collect far more data than you would, because now you don't need to physically go to people. You may be able to send the questionnaires using your mobile phone. For people in urban planning and all these sort of things, we now have very powerful computers that allows you to model out a whole city, and you can look at human flow, you can look at air quality and which direction pollution is going to happen, sitting basically in front of your computer and using advanced planning and simulation technologies. So, and again, also emergence of new methodologies that we are now able to do because of computing. We're able to do much bigger, what you call big data analysis, by virtue of having. So again, these are research gaps. So is the research available? Is available for that particular population? As new technologies emerged, have new knowledge emerged, have new techniques emerged that you can use. Thank you. Oh, back to you, Manene.
Thank you so much, Prof. Sam, Sam for coming over. Thank you for the questions. Thank you for really taking time to outline a part of the research journey paper that is so problematic for many people. But I'm sure now we have clarity of how we can move forward. And thank you so much. Please stay on. We still have Dr. Release. Dr. Release is the Director of Quality Assurance, Acting Dean, School of Education based in Kigali. And she's also going to share a few insights also based on her own experience with students developing the problem statement. So let's also listen in. She'll only take 20 minutes and also ask questions. So Dr. Sam, you can stay if you have time to. But from our end, I can see everyone is really so happy for coming and clarifying research gaps. And really, we've maintained a capacity of 100. So yeah, and so many were locked out, by the way. So over to you, Dr. Release.
Thank you so much, Aurelia, and thank you, Prof. I joined in and I've just been soaking knowledge. One thing I believe in is that we always learn and learn and relearn. So I have also taken my beat, and thank you very much for that insightful presentation. Mine would be from the perspective of a teacher. I gather that people in this room are not just the PhD holders. We also have master's students, and I want to believe that I'm right. If you're a master's student, just put up your hand so that I know I'm right. Put up your virtual hand. I'm not seeing any. Aurelia, I've seen one. Have I seen one? Aurelia, can we see any?
Yeah. They're about 4 hands.
Yes, there are about 4 hands.
Yes.
So I am here on behalf of those who are still in their low levels of research, even as we refresh what we know. But as I've said, I'm going to look at it from the teacher's perspective. Allow me the sharing rights, please. I'm going to take us through not more than 20 minutes. Prof has already done a very good job. So I just want to have a wrap up, but looking at the perspective of a teacher.
Karista, please make Liz Owino a co-host.
Liz, I suspect you have to put off the video and just do voice.
Okay, it's not possible.
Yep.
You're a co-host now.
So what did he say?
You're a co-host. You can share.
Okay. So I guess you can all see.
No, I was just saying that your video may
Yes.
be taking a fair bit of bandwidth, so maybe you could put off the video and remain on
Can you switch me
voice
off?
video.
Are you able to switch me off?
Or you can't on your side remove the video.
Let me see.
Okay, yeah, you can continue.
Okay. Thank you.
Share the
Sometimes
slides again.
Sometimes these gadgets just misbehave.
It's all right.
Yes. Yes. So from where we are all seated, my understanding or my experience, first of all, I want to mention, as someone talked about problem and topic. I think it is from the problem that we end up having a topic. So a topic comes much later after we have identified which problem we want to zero on. So from my experience, there are many factors that determine the choice of a research problem for most scholars in Africa, and specifically for most students that we have in our universities. For the sciences, biological sciences, and even the applied sciences, we may not have a big problem. But for the social sciences, this is where I've really seen a big problem. You find that most of our students pick problems from just the eye level. I remember the prof has really talked about reading widely. We get to experience, we get to hear, but then we also have to really get to the problem by reading widely. So we cannot avoid reading widely. You look at the archives of many institutions, it is just problems that have been replicated. Maybe you only change the timing or geographical location, or you change one or two questions. And that is not the best way of approaching research. So because we are having challenge from where we are, especially the institutions of higher learning, we should rethink having a research problem that is well thought out after or for is very important, because it makes you continue with the problem looking at it from various dimensions. So it is not about the easy thing that makes you graduate, because most of us want to graduate very quickly. So we think of a problem that has been done severally. We think of a problem that we can look into very quickly and graduate. So the end result is often graduation rather than solving a problem. Prof has already talked about key elements of research problem, of a problem statement, and research is research. Whether you are in the basic sciences or you are in the applied sciences or social sciences, is the same thing. The key elements of a problem statement remain. He has talked about find out the ideal situation. Once you have identified the problem, is it food security? Is it climate change? Is it CBC? Is it university funding? Find out the ideal situation. And the ideal situation, we will not obtain it if we do not dig deep. Most of the time, we just scratch on the surface. It takes you long to really get to the ideal situation, because most often what we see is not what actually is. So we see what it is not. Then go to the current reality. After describing or after finding out the ideal situation, what is the current reality? And I actually had him talk about why are we looking at a particular problem? What is the current reality? What is the existing condition? What is the existing problem? That is the second element of a problem statement. And then look at the impact. What is the impact of not addressing the problem? You are trying to justify, why should I look at this problem from this angle? What would be the impact if I do not look at that problem? Then we have the proposal. What are you proposing? What kind of solutions or approaches do you want to present or do you want to propose? So these key elements of a problem statement are very important, regardless of which area or which discipline you are coming from. So a well-crafted problem statement will make sure that everyone involved understands the issue, the significance, and the direction for potential solution. So that is why you must be key to find out the key elements or to make sure that you capture the key elements of that problem statement in your research. So as you write out that problem statement, I also saw a participant ask how many words or how long. Just make sure that you are clearly explaining the problem that you are focusing on. It should be short, it should be clear, and it should be talking about the issue or challenge that you want to change. As Prof said, universities have different templates. One university will tell you half a page, another one will tell you 1 page, another one don't go over 2 pages. So you must align yourself to an institution because you are affiliated to an institution. So this is very key, that in your problem statement, you explain what the problem focuses on, describe how things would be better if this problem did not exist, talk about what other researchers have done, and what still needs to be figured out. This actually summarizes the key elements that I've just talked about. Now we have steps that we can follow in order to come out with a problem statement. It is not that these are the hardline steps, but they are steps that we need to consider as we look at our problem statement. So first of all, it must be your own area of interest. I've seen situations where supervisors want to manipulate students to fit into their area. That will happen if you are not grounded in literature. If you have not read widely, then it is possible for you to be moved. And I realized this when I was doing my PhD. I can remember that initially, every meeting, I would go with a different problem until my supervisor told me, no, we are not going to change. Go and read and think about your area of interest and let us dig into that area of interest. After finding your area of interest, then learn more about the problem. If you have been listening, this actually aligns to the key elements that we have just talked about. Learn more about the problem. You may learn more about the problem by opening your way of thinking, your mind, the people you engage with. What helped me most was that once I developed my area of interest, I was willing to share my problem with everyone who was willing to listen. And I've also seen this with the participants who have been trying to bring in their areas of interest so that they can also hear the perspective of others from the problem. Then review. Data is very important. What data is there about that problem, about that context? What information versus the data? Because you can have information, but the data that you have do not speak to the information. So data that you have should also speak to the information about the problem. Then look at your variables. I get so worried when I see students at the point of proposal defense or thesis defense or dissertation defense, they still are not very clear about which are the variables. What variables are you looking at? Which is your independent variable? Which is the outcome variable that you want to look at? That you think by solving this problem, it will be answered. Then select and include important variables. Not all variables that you think about may actually be important for your problem. So it is important for you to include variables that will be important. I always find it interesting or very beneficial when I, with my student, we consider all the variables and then the student selects what they think is very important in their study. And of course, it is important to get feedback. get feedback. And feedback, you get it from your peers, you get it from your supervisors. Do not even just focus on your one supervisor. In a department, there could be several people. There are several people or teachers or lecturers or wherever there. It is important for you to try to get feedback as much as possible. And as you get feedback, look at the way you can revise this feedback, having in mind that it is about your area of interest, not anybody's area of interest, your own area of interest. So you use feedback to either support, correct, focus, yes, or work on your, yes? Hello?
No.
Can we mute that person, please? I have come, I decided to bring about some problem statements and just let the participants, let us, all of us, look at them and critique them, given the information that we already have about problem statements, the key elements, and how you arrive at them. I am not a basic scientist, I'm a social scientist, so you'll bear with me if I am so much aligned to that area. Let's look at the first one. That is a problem statement. We need to improve our website to increase sales. I would want a participant to tell us whether this problem statement is good enough or what we need to do about it. And Aurelia, you'll help me because I'm not able to see the participants.
Okay.
So we need to improve our website to increase sales. Any participant who would like to look at this and critique it?
You can unmute, you can raise your hand and answer.
Yes,
There is
let's
John. John,
interact.
go ahead.
Yes, the issue with the statement, this problem is that it is based on assumption that when the website is improved, the sales will automatically increase. That means it's like you are giving the answer to something that you had not even gone to the field to look for the information. Thank you.
Thank you. Thank you. Any other participant? Yes, Jeremiah.
To me, I think actually what this problem statement is lacking is it is not giving us a clear picture of the ideal situation. And actually, also it's not telling us the current, what should be happening and what the consequences will be if the website is not improved. Thank you.
Good. Anybody else? Anybody else?
Maybe I can try.
Yes, please try.
Yeah, for me, I feel is like there's no data to back that, to back this statement. So it's just like, what do I say? It's like just a thought, kind of, but it is not something that is backed by any statistic to say that if sales, if we improve our website, the sales will automatically go up. So there's no statistic. Thank you.
Very good.
May
Charity?
I talk?
Yes, please.
Okay, thank you so much, Dr. Wino. Based on what you've presented on the elements of problem statements, I see this statement is relying on a proposal where that you've said we need to improve our website to increase sales. It means that there was problem and then the problem has been identified, and then here what is needed is only solution in order to increase the sales. Thank you.
Excellent. Excellent. All the participants have given excellent perspective on this problem statement. So what I'm gathering is that this is not an ideal problem statement. It is like it's already offering a solution. It is not giving us, any room to identify or to come or to probe what the problem actually is. Let's look at the second one. The second one, the high school dropout rate in our community has risen by 20% over the last 2 years, negatively impacting our future workforce. We need to implement targeted intervention programs to reduce dropout rates and ensure a more educated workforce. Anyone who wants to contribute to this? What do you think about this second problem statement? Tell what you think about it, critique it. Yes, Jeremiah, again. I've seen two other hands. Yes, Jeremiah.
Thank you. This second problem actually has started well because it is giving us some data to show that there's a problem.
Mm-hmm.
But to me, unfortunately, it's conclusive.
Mm-hmm.
In that they have the solution. There's no problem coming out clearly because they've just talked of 20% and then it's impact and that is done. So to me, it is not bringing out the problem clearly. Thank you.
Thank you. Thank you, Jeremiah. Charity, you're the one I can see. Then Kefa. Charity, yes? Charity? Okay. Charity, your hand is raised. I've given you an opportunity. Kefa, you can take the mic.
No, thank you so much, Daktari and the team. I think the second one, it has a statistical backing and it also has a futuristic approach. And I don't think I stand to be guided as well. I don't think it has conclusively a conclusion of the solution. Rather, it's just saying we need a targeted. So there's aspect of let us go outside there and do an impact research of how we can secure the future. So there's a correlation between the present affecting the future, which the future again will become the present, which also will target again the next future. Thank you.
Thank you. Any other thought? Generica?
Just to add something small, I see the statistic is there for 20%, but it's not citing from where. So who did this rate? Who came up with this statistic? So we need to include.
And thank you very much. I cannot see any other hand that is up. So you can see the second one is an attempt to improve on the first one that was very straight and to the point and not showing the kind of problem. It's just saying we need to improve this. This one is giving us a statistic. It's actually saying over the past 2 years, although it falls short of giving us where is this from? Is it from my head? Is it from scholars? Where do we get this 20%? And then talking about the futuristic, what we need to do. So it talks about an intervention that needs to happen to reduce this school rate. And I just want to show you the third one. Forget about the sales. Let's go to the last one. An employee turnover of 35% in company X is negatively impacting productivity, morale, and profitability. Any hand? Anyone who wants to comment on the third one? Yes, Kefa?
No, thank you so much again, Daktari. I think this one is from my analysis. I think it's coming, I assume it's coming from the HR. So there's aspect of dependent and dependent variable, whereby one person's reaction will affect the Commonwealth reaction to the job market, therefore affecting the company overall. Thank you.
Good. Last one, last comment. Yes, Jeremiah.
Sorry, I forgot. Sorry, before Jeremiah comes. But the problem with this statement has not given us what solution, how do we resolve it or how do we mitigate? So thank you.
Is that Kefa?
Yeah, this is Kefa. Sorry, I forgot to mention that.
Thank you. Thank you, Kefa. Jeremiah,
basically what Kev has just said is what I wanted to say. Whatever he's saying there, that any employee impact productivity, yes, so what? The question is, so what? Thank you.
Good. I believe you are speaking on behalf of all the others. We have seen that the key elements that should be in a problem statement: ideal situation, current reality, consequences, and the proposal. And we have also learned that it does no harm to include a source or reference to show us this is where this data has been obtained from. In our approaches, we also understand that we have various approaches to research. We could be qualitative, we could be quantitative, we could also be mixed. It's very important for us to understand that as we craft our problem, the approach we choose will determine the purpose, the focus, and how we craft our problem. So it is not generic that we use the same approach or we use the same statement for qualitative, for quantitative, and for mixed research. And I just want to wrap this up very quickly because we are already past 11:30. So when we look at, I wanted to compare, or I want you to now give me the comparison because I guess you have a little knowledge about qualitative, quantitative mixed research. And so I'm just throwing this so that we discuss. I want to make it as interactive as possible. If the purpose of a problem or the purpose of a research is to explore a phenomenon in order to understand the meanings, experience, or concepts, what type, if that is the purpose, then what type of approach would be fitted for this purpose? If this is the purpose of the research, to explore phenomenon in order to understand meanings, experience, or concepts, then this purpose would be fitted, would be best fit for which kind of research?
Yeah, excuse me.
Yes.
Qualitative.
Hello? This is a qualitative.
Qualitative. Very good.
Yes.
Just throw the answers, qualitative. How about if the purpose is to examine relationships between variables to test hypotheses and measure occurrences?
Quantitative.
Then what would be the approach? Yes? Quantitative. And so the last one is obvious, that where we want to combine or we want to provide a comprehensive analysis, then if that is the purpose of the research, then definitely our approach will be a mixed method approach. So let's look at these problem statements and again, tell me, which approach do they speak to understand the how or why of a phenomenon? This is just a summary of the statements. Which approach does it speak to? Throw the answer. If our problem statement, yes, focuses on understanding the how or why of a phenomenon, which approach is most likely suited for this statement? Yes?
Quantitative.
Quantitative?
Yeah.
Quantitative?
Quantitative.
Qualitative. Because we want to understand meanings, experiences, concepts. So in that case, if that is our focus of the problem statement, then the approach we are likely to use is qualitative. If the problem statement articulates the need to explore both numerical and the contextual understanding, definitely the approach is
mixed method.
Quantitative.
Definitely the approach is, yes?
Quantitative.
Good. And then when we want to measure, to emphasize, or when the problem statement focuses on measurable aspects, often addressing the what, the where, or when, then definitely the approach is mixed.
Mixed method.
Very good. So these are the examples. We have already looked at the examples from what we had. I just want to wrap up by giving us the tips that do not forget that in problem statement, being specific is very important. When you are specific about what you want to do by clearly defining the problem and giving precise details, that is where we have the data to accompany what we have stated, then we are making it specific. Secondly, we must use data. Using data is important because it illustrates the extent of the issue that we want to consider. Avoid giving solutions, and I'm glad that you could pick out the statements that you have just given and identify that one is to give solutions. Because if the solutions are already known, is there a need for us to go on with the problem? And the answer is no. And then lastly, it is important for us to always know that our problem statement should identify the impact. So what if we don't carry out that study? Is there an impact? Is there anything worth noting if we do not carry out that study? So who is affected by the problem and why facing that problem is important for you as a researcher. And so that wraps up my session, and back to you, Aurelia.
Thank you very much, Dr. Liz, for that presentation. And is with what you and Prof are saying, and I think it really enhances the topic as we are going on. So we will just give room for 2 questions because of time. Then I'll invite both our presenters to give their parting shots. So 2 questions for Prof Liz. I've seen you've been very interactive. Then Sam and Liz, you'll give your parting shot. Yeah, so 2 questions. Anyone with a question?
Yes, Emmanuel.
Yes, go ahead.
Thank you so much. Thank you, Dr. Owino, for your presentation. From your presentation, there is one question that I had, and then I want you to clarify more. There are elements that you talked for the problem statement. The last one was to give proposition for when you are designing a problem statement. And then here, for the tips, you've said that we have to avoid bringing solutions in the problem statements. How can we link this one, and how can you clarify this proposition or solutions that you can design during the problem statement with this one avoiding solutions? Thank you.
Thank you. You want me to answer this, Aurelia, or I wait for the second one?
There's no other, so you can be answering.
Okay. So thank you. Your name is a bit Sinabura. I don't know. Sinabura.
Yes, Emmanuel.
Yes.
Sinabaraga.
Thank you. Now, when we talk about the key elements, we say proposal. Here, proposal is not a solution. Here, proposal is looking at it that should you not undertake that research, what is the impact? Or should you take up that research, what would be the impact? So you are proposing is like you are giving a significance of why this research. So it is not saying giving the answers. We are avoiding giving the answers because if you have the answers, then why go for the research? Thank you.
Thank you so much.
Can you give an example of proposal?
You want an example of a proposal?
Yes.
John? Sorry. I think I would give an example like if it is a medical intervention, maybe you want to bring out or you want to introduce a vaccine. So when you are giving your proposal as a key element, you are bringing out the fact that should this vaccine not be introduced, then these are the consequences. So you are trying to justify, bring a significance of why your research is important. Should this not be done in CBC, for example, training of the teachers, if teachers are not upskilled or retooled, then it means that the students will not have the skills relevant for them to proceed from one level to another. So that is a proposal.
I think we have a final hand from Jeremiah.
Thank you very much. Something has just come into my head. At times, I get confused with when I'm asked to include in a problem statement the component of isolating factors. What are the isolating factors of the problem? So can Dr. kindly clarify on that?
Aurelia, would you take that?
Maybe I give it to Sam.
Because I'm not very sure about that. So you're saying you're asked to isolating factors?
Yes, that is after you've come up with the ideal. After you've come up with the ideal situation, then the current situation, the consequences, you are also asked, can you also include the isolating factors of the problem in your problem statement?
No, I will confess ignorance. I'm not sure. I haven't come across that request, and I'm not sure what they mean. I'm not sure whether they mean what is. We would have to engage a bit more with what the university means with that particular one. I'm assuming they may be asking, although this is really guessing, what is unique about your approach or something, but honestly, I don't know. I can see Lino, maybe he has a comment.
I can see Lino is asking, could the proposal be the same as what Creswell calls the purpose statement? Now, the purpose statement, she said, could the proposal, because the proposal begins, the schedule of events, a whole document. But here, we are just dealing with, the purpose statement is like, what is the purpose of your research? What is the significance of your research? But when we talk about proposal, it's the whole document from the introduction to how, like the schedule of activities that you're going to undertake, unless I didn't get you well. You help me there?
And again, some of these terminologies are very specific to universities. So purpose, objective, aim could mean exactly the same thing. And so what I would advise is go back to other theses and dissertations in the library that have been passed and just look at. So for example, what the Daktari has given or what I've given, in some universities, it may fall under justification. It may fall under problem. It may fall under purpose. The key thing is using those elements, you might be able to adapt them to the template of your university. So it's important also to look at what are ideal dissertations, and often you'll get them from the library. Then adopt the elements that we have talked about to the format that you see in those theses. In fact, I always advise my students to look at other theses that have passed through a particular university. Then that makes it easier to work out where the information is. But the elements we have talked about apply in any case, whether it's you're calling it purpose, justification, problem statement, etc.
Okay, thank you, thank you. I think now we are going to wind up. I can see we are still at 100 people. People have
Excuse
really
me.
been excited by this.
Somebody seems to have a question.
Yes,
Okay, there is
excuse
one
me.
more.
Yes, for the one who asked that isolating that factors in a research program, I also guessed that maybe the supervisor wanted it from him to highlight variables or datas from his research that to be in line with the topic that he already set. So to mean that reading different books, reading different journals will bring the ideas relating to the variables that are needed. That's what I guessed.
Thank you. Am I seeing something on chat as well? Oh, they are mentioning the proposal. Okay. I think you've responded. Okay. So thank you. We've shared the link for now to register for the WhatsApp. Those who are asking. Let's have a parting shot from Sam, then from Liz. Thank you.
Maybe I can start if Sam is not coming over.
No, I am on. Yeah. So,
okay. So sorry.
I really just to say, first of all, thank you very much, everybody, for not only attending but staying on, and really good questions. And a very big thank you to Oleria. This is really good work you're doing. I really appreciate the challenge that students face. A number of you have asked whether I can look at their proposal. I won't promise to be able to look at all of them. I'm quite packed, but if I do have time, I may be able to look at a couple. Thank you.
Thank you very much.
I want to say thank you very much, Aurelia, for what you do. It's always a learning space for all of us. And for the participants, always it's good and it's great and encouraging to see that you dialed at 100 and we are closing at 99. Very encouraging. Let's continue engaging. Let's continue sharing. Asking is not that you are foolish. Asking is because you want to make yourself, you want to make things more clear. So never feel shy to ask and never feel shy to talk about what you're doing. Thank you.
Thank you very much. So if you want to join our WhatsApp, I've put the link there. The organization that is hosting this is Ada Africa. We also have an upcoming NVivo course on 31st March. Some of you have been requesting, instead of having 4 days of training, if we can do a crash course of a whole day. So I've put the poster on there. It's a paid course though. So it's 31st March, a full NVivo training. This is our 14th cohort. Quite a number of people registered for those who are doing qualitative research. Otherwise, from us, let me share the link again, is just to say thank you very much. That's the reason why we formed this space, so that all of us from Africa, from wherever we are, we can come and learn together. And as you can see, from wherever we are dealing with the same issues. So thank you, Prof. Sam. Thank you, Liz, Dr. Liz, for coming. We really appreciate your time and presence. Have a good time, everyone. And let me reshare the WhatsApp link, and I wish you a good time. The recording will be shared. We always share. We reverse it to you.